Loesch, who is nationally syndicated radio talk show host and author of the book, Hands Off My Gun. Dana, good to have you with us tonight. I appreciate your time.
Of course, Ed. Good to join you here from Dallas, Texas at the Blaze headquarters.
Are the Cowboys going to be okay now? I mean, I keep hearing, I mean, what's happening there? Is Romo going to be back or what? Let's get the important stuff out of the way first.
I moved here to Dallas about a year ago, and I've kind of adopted the Cowboys, although I'm always going to be, I'm originally from St. Louis, I'm always going to be a diehard Cardinals fan.
All right.
But, you know, I'm confident because they're doing better than the Rams, let's be honest.
Let's get to health care. Why do the Republicans not have a plan on the table, Dana? All they talk about is repeal. The numbers I gave are facts. Your thoughts?
Right. Because Harry Reid's hit it on his desk. That's why. You know that there are over at least 9 plans that have been submitted by House Republicans and sent to the Senate alternatives to Obamacare. Several of those which were presented prior to the passage of Obamacare. So, I mean, ultimately, I think that's kind of a question that we need to ask the outgoing Senate Majority Leader, Harry Reid, because there have been plans presented. Not all of them I've agreed with, but a lot of them have some really good stuff in there that I think should have been included in Obamacare.
Okay, so what do you agree with, and what do the Republicans agree with of the numbers that I put out?
Well, you were citing White House numbers, so I'm not quite sure what that you had mentioned.
These come from the Congressional Budget Office. These are,
I know, and I have some numbers for you from the CBO, because we know how the CBO works. You know, they just kind of score what you give them.
No, wait a minute now. No, okay, so whose numbers do you want to believe? The Congressional Budget Office is nonpartisan.
I'm going off the American people that have reported in. You were saying that, what did you say, Ed, that you said Republicans want to run 10 million people off of health care.
They do.
Well, I would say that the administration's done a really bang-up job at that so far, because 4.7 million people have lost their insurance in 32 different states.
Dana,
so
are there more
people?
Wait a minute. Are there more people in America today with health care than a year ago? That's a yes or no.
No, there are a lot of people who've lost their health insurance.
All right.
I have a lot of family members who've lost health insurance.
There's no question.
I have a lot of friends who've lost health insurance.
That's because it was junk insurance. But let's go back to the.
No, wait a minute. You don't get to put that out there.
No. I'll get to that. I will get to that.
They're not junk plans.
I'll get to that. There are federal standards right now that have to be met, or they can't be sold in the marketplace.
I know they lower their criteria.
All right.
I know it's unfortunate.
I want to be very crystal clear. You say that there are fewer people in this country with health care today than a year ago. Did I hear that correctly?
Remember, it was PolitiFact's Lie of the Year just recently that the president promised if you like your health care plan, you can keep it.
That's not the question. I want you to tell my audience.
Obamacare was good.
Dana, I'm not going to do this. Dana, hold on. I want you to deny this fact. There are more.
In which we're dealing.
Are you telling me that there are fewer people with health care in this country today than a year ago? Yes or no?
I am telling you that Obamacare has absolutely cost people.
You won't answer the question. You won't give me an answer. You don't like
the way that I'm answering it because you want to move the goalposts.
No, I'm not moving any goalposts. It's a hard fact. Either you have insurance or you don't.
Do you believe that Obamacare has given more insurance to people?
Dana, I'm doing the interview here. I'm showing you respect by doing the interview. You're interviewing me back.
I'm doing you a favor by doing this interview, Ed.
If it's a job killer, why have we had 55 months of private sector job growth?
Why did the CBO say that it's actually
You're answering with a question. Let's go to Crystal Ball. Crystal, are these numbers phony?
The numbers are not phony, and I mean, it's unequivocal the fact that we have more people now insured than previously. And it's been a huge lift for young people. It's been a huge lift for people of color. It's been a huge lift for women. And, you know, the idea that we did have some bumps in the beginning, certainly the case. The idea that some people did have to switch to different insurance because it wasn't up to the standards of the law, certainly the case. But overall, if you look at the country as a whole, there is no doubt that folks are better off. They have alternatives. They can't be kicked off their coverage. And there's nothing that the Republicans have offered that comes anywhere close to
Dana says there's 9 plans out there.
They have offered various little piecemeal things like selling across state lines, and none of them, but Dana, do any of them come close to ensuring the number of people that the ObamaCare Act insures?
Well, I don't think that they would have cost 4.7 million people perfectly good health insurance plans.
Well, in fact, some of them would have.
I don't even think half of it had been read by the Senate.
We again, to answer your question, though, I mean, would the Republican plans cover as many people as Obamacare does?
by the federal government, it would make it exponentially easier for people to get health insurance.
That's
I mean,
just
one of the
not
things,
true based on what the CBO has said.
All right, let's go to Dr. Aber.
No. First off, that's not true either. I mean, you can't say that that's not true. It hasn't even been sent to the CBO.
Independent analysis.
Oh, now you're quoting the CBO. Wait a minute. First you're vilifying the CBO, and now you're quoting them.
Don't jump in here and say Crystal. Let me talk to Crystal for a second. I'm not quite sure.
Excuse me, you're not running over me. You're not going to filibuster. Dana, you're not going to filibuster. I'm not going to let you do it. I'm not going to let you filibuster.
Let me answer your question. You asked me earlier.
I'm going to go back to this question. You're being unworkable right now. Okay, just hold on. I'll give you more time. You're rude as it stands right now. I gave you the first shot and you ran all over it. Doctor, how can it be bad for business if all of these insurance company stocks are up?
Whoa, I just got to get a word in here. I'm glad because I bring a different perspective. I'm looking through a different lens. If the young lady that's on the camera right now would understand and look into a patient's eyes, a person that has never had health care in their life, that will now come to the clinic, and which happens to my clinic almost every day, and say, I have diabetes, I've been going to the ER, which has cost my hospital $1 million over my lifetime. Now I have primary care. Thank you so much for allowing this to happen. When you can do that, and then look in somebody's eyes and say, you know what, I don't want you to have that insurance, then we can talk. But until then, they just don't get it.
The Republicans have not come out and said, okay, this is what we're going to keep on Obamacare. A, B, C, D. They haven't done that. All they've done is talk about repeal. So, Dana, let me go back to you. Was there junk insurance in the industry before this law, yes or no?
Well, first off, we're not going to frame the questions that way.
Why not? What do you mean? What are you talking about?
Hold up.
We're not going to frame the questions that way? Okay.
Did you just bring me on here to yell at me for 10 minutes?
No, I want you to answer the questions. I want you to answer the questions. Was there junk insurance? I'm giving you an opportunity here.
This is how you need. I'm giving you an opportunity.
No,
this is how you need to ask it.
I'm doing the interview here, Dana.
Do I believe that insurance was perfect?
Dana, this isn't working. You're being very rude. You're not the host of the show.
Are you going to let me answer?
You're not the host of the show. I'm going to give you the floor for 30 seconds. Go ahead.
Go ahead and yell at me. Oh, wait.
You have the floor for 30 seconds. Go ahead.
Okay. Do I believe that health insurance needed to be reformed? Absolutely. I completely believe that there's a number of things that we could have done. We could have increased portability. We could have decoupled business from people's health insurance so that they could always maintain their health insurance, no matter if they had to change jobs or not. One of the things that I wish government would do, and I hope, Ed, that our Republican Congress takes this opportunity to do, is to increase competition. We can have more choices, and we can have less cost.
Dana, excuse me, there are 25%.
Okay, you're going to yell at me now? All right.
Dana, now, I'm interrupting because I gave you 30 seconds.
I know.
Now, listen, there's 25% more competition in the market today offering plans. So that's been taken care of in that regard. The fact is there are federal standards now. There are federal standards that must be met by the insurance industry that they can't sell plans that don't live up to what consumers need. We had an election. That has been decided. Yeah. Okay?
And we've had another one. And we have a Republican Congress.
Well, turn it around. That's good. Hey, look, you've got the power. Give us a plan. That's the whole point of this thing.
We've had plans that have been submitted, and no one wants to acknowledge that, which is really disingenuous.
On the specifics of if you decouple the employer insurance, that would entail a lot of people losing their current insurance, which is what you're upset about right now. That's exactly what that would entail. I mean, one of the reasons that Obamacare was crafted in the way that it was to keep as many people on the plans as they have. Now, as you pointed out and as Ed pointed out, some of those plans that people had didn't meet the standards of quality health insurance. So, yes, it was not 4.3 million people, but a number of people did have to switch to a better, more higher quality plan.
All right, Dana, you have the final word.
I just have a quick question. If we're talking about standards of care, I'm just sort of curious as to what standards of care having people, like I have a very good friend of mine who is dealing with breast cancer. She lost her health insurance in St. Louis. She's dealing with Obamacare. She now does not have any access to the cancer centers, not just St. Louis, but in a number of cities.
I want to interview her.
Seattle included.
I don't believe that.
Seattle
I want to interview her. Dr. Aber, do you believe that?
But you sit here and you discount all of them because
she may not be able to keep her exact health care plan plan because of the doctor that she wants, but that doesn't matter because it's about for all, not just one person.
Okay. That's all we have time for. First of all, Dr. Corey Hebert and Dana Loesch, what a pleasure. Good to have you with us tonight. Thank you.